Hi, my name is Samir Sur, and I'm a neurosurgeon at MedStar Health. So my clinical areas of interest and specialization is in cerebrovascular neurosurgery, as well as skull base and endovascular neurosurgery, which sounds like a lot, but really specializes on complex brain tumors that can occur in and around the base of the brain, as well as vascular disease like aneurysms and problems with blood vessels that go towards the head or inside the head. My patients are often diagnosed with things like cerebral aneurysms, which are weaknesses in the blood vessel, which can occur usually in adulthood, but at any age really. And also tumors, which can occur in and around the brain and usually occur in young adulthood to older adulthood. But again, these things can affect patients of all ages, really. Patients can present with a variety of symptoms. Sometimes they can be things like headache or seizures, and sometimes aneurysms or other problems with blood vessels can be diagnosed incidentally when patients come to the hospital or get scans for other reasons. And the risk there is to determine how likely those blood vessels are to cause a problem like bleeding in the brain, which can be very serious, and how best we can fix that in a way that's safe and tailored to the patient's lifestyle and needs. Neurovascular surgery, including neuroendovascular, cerebrovascular surgery, is a specialty of neurosurgery which deals with vascular problems of the brain. Those can be things like weaknesses of the blood vessel, which can lead to bleeding in and around the brain, or other problems like headaches or seizures. And we're fortunate to be practicing in a time when we have a lot of different devices and technology and technique that we can use, including minimally invasive openings in the skin and the skull, as well as techniques inside the blood vessels, which is called neuroendovascular techniques. Traditionally, our patients that undergo neuroendovascular procedures have had a catheter placed through the large artery in the groin. More recently, we've started to use the radial artery in the wrist as our access point, which allows for, in some cases, better navigation and access, and in general, decreased pain and quicker discharge for our patients. Finally, we've also found that the transradial approach is a little bit safer for small complication rates than the transfemoral approach. We are really fortunate to be able to utilize a wide variety of new innovative technologies in our cases. On the endovascular side, we can use specific devices to be deployed inside blood vessels to treat a variety of different problems with blood vessels inside and around the brain. And when we do microsurgery, we can use navigation, like a specialized GPS system, which allows us to use smaller craniotomies or openings to the brain to do complex tumor resections with very small incisions and shorter operating times. I think one of the most unique things about our practice here at MedStar is that we have multiple providers who are able to do and perform some of these highly complex techniques, and we take a collaborative approach. So we are constantly in communication, attending national meetings, staying with the up-to-date literature so that we kind of benefit from always being in touch and making sure that we are always on the cutting edge of the treatment that we are able to offer our patients.